Hello, my name is Pauline RN. The title of my video today is on mobility. Questions and answers from RN NCLEX examination. This is part 1. Please hit the thumbs up. Please subscribe with that black button. Please share this video with your friends, families, and classmates. What is plantar flexion? Correct answer: one of the physiological effects of immobility. Intervention for plantar flexion will use pillows to position heels. Use waffle boots to position and redistribute pressures off the heels is the correct answer. When moving a patient up in bed, state RN's position. Correct answer: RN stands even at patient's shoulder is the correct answer. Next question. Patients with DVT. Assessments and interventions for patients with DVT. Assessments and interventions for patients with DVT. Correct answer: assess pain, redness, swelling of the calf. Measure the calf of the patient's leg and document. Next question. What is the intervention for your patients when getting them up out of bed? Correct answer: first you check their blood pressure. If your patient's blood pressure is low, they are at risk for falls. When patients are getting ready to stand, before standing, dangling legs before standing is the correct answer. So patients with low blood pressure, you're gonna do assessments before getting them up out of bed. And remember, patients' blood pressure sitting and standing, those are two different blood pressure. If patient's blood pressure is too low, patient is at risk for falling. My next question: what is your assessment for patients with paralysis on one side of the body? What is your assessment for patients with paralysis on one side of the body? Correct answer is assess extremity for unilateral swelling and atrophy is the correct answer. Patients to prevent blood clots, what medication would your doctor order to prevent blood clots? The correct answer is heparin sub-Q. Heparin is always administered subcutaneously. Plavix, aspirin, Coumadin. Patients who are immobilized. Patients with inadequate fluid intake is at risk for what? Immobilized patient with inadequate fluid intake is at risk for what? And the correct answer is risk for thrombosis. Impaired skin integrity. Respiratory infection. Constipation, UTI. The elderly develop UTIs. because they are not hydrated adequately. So offer fluids to your elderly patients. Immobilized patients with inadequate fluid intake are at risk for constipation, UTI, impaired skin integrity, respiratory infection, risk for thrombus, blood clot formation. Turn and reposition them every 2 hours. Get them up out of bed if you can. Next question. What are the signs and symptoms of immobilized atelectasis? The correct answer is decreased breath sounds. For these patients who are immobilized, who have immobilized atelectasis, we should do range of motion on these patients. Range of motion exercises on these patients. Move them around every 2 hours. They are at risk for develop pulmonary problems. Decrease breath sounds. Next question. How do we assist patients transferring from a bed to a stretcher? Correct answer. First, before you transfer your patients, maybe they are going to OR, maybe they are going for a procedure. First, the nurse assess the situation for potential unsafe complications before you transfer them to the stretcher. Remember, some patients have Foley catheter. If you're getting your patients out of bed to the stretcher, remove your Foley catheter from the frame of the bed before you transfer your patient to the stretcher. Next question. When giving care to your patient in bed, what should you assess? Number one, when you're giving care to your patient, the correct answer for safety, assess that all side rails are up. If the nurse is bathing the patient in bed, all side rails are up. She's going to bathe the patient. She's going to bring the bed up to her safe position. She's going to lower the side rail that she's giving care from. If she's going to be standing on the left side, she's going to be bathing the patient. The side rail on the left side must be lowered. That's the side she'll be working from. She's going to turn the patient away from her, which means the right side of the bed rails remains up. The patient is facing the right side rail should be up. We do not want the patient to fall out of bed. She turns the patient away from her to her opposite side. Patient back is turned to her and the side rail is up to promote safety. When she turns the patient away from her, she is able to do a complete head-to-toe assessment with the patient's back turning towards her. She can assess the buttocks. She can assess the sacrum. She can assess any signs and symptoms of abrasion or scars on the patient's backs. So that's your correct answer. When you're giving bed care to a patient, it's all about safety. The side the patient is turning to, the side rails must be up. The patient is turned away from the nurse. She can assess the patient's complete back from head to toe is the correct answer. My next question: what are your elements of normal movements? The correct answer: 1, body alignment; 2, positive joint mobility; 3 is balance; 4 is coordinated movement. These are your elements of normal movements is the answer. Next question: what is your center of gravity? Correct answer: point where most of the body weight is concentrated for a body or object. Next question: what is BMR? What does it stand for? BMR, correct answer, is basal metabolic rate. It is the rate at which a person uses energy when the body is at rest is your correct answer. What are your isokinetic exercises? These are, for example, your stationary machines, your stationary bikes. Exercise involving muscle contraction with resistance varying at a constant rates. These are your isokinetic exercise. Next question, we're talking about our isometric exercises. What are these? Correct answer: involves muscle contracting with resistance varying at constant rate. Example: squatting, plank exercises, yoga. Next question is: what's the first step to assess a mobile patient? The correct answer: the first step to assess a mobile patient, correct answer, is assess body at ease is the correct answer. When assisting an obese patient to stand, what should the nurse do? The correct answer for obese patients: always ask for help is the correct answer. Assess the weight of the patient, ask for help. Some obese patients, you need to use a Hoyer lift to lift them from bed to chair or from bed to stretcher. Next question: when helping patient with unilateral paralysis to walk, what should the nurse do? The correct answer is stand on the weak side. Use 2 points of support at all times. Example: crutches. Use 2 points of support on floor is the correct answer. Please hit the thumbs up. Please subscribe with your black button. Please share this video. Thank you. Stay blessed. Take care.